Hello student, welcome to the session of Physiology. In this lecture we will see about the excitability and the generation of the resting membrane potential. Now what do you mean by excitability? Excitability means what? If an appropriate stimulus is given, the cell will respond to it. The response can be either the mechanical, the response can be either the secretion of the something, or it can be even just the generation, it can be because of some electrical activity also. Now, whenever the stimulus is given or impulse is given, what it is actually it causes. The stimulus can be of any form. It can be physical, it can be chemical, it can be thermal, it can be electrical. And what ultimately it is going to cause? It is going to cause the change in the membrane potential. Now what do you mean by membrane potential first? What exactly the meaning of the membrane potential? So if you look into this figure, what we have done in this is that suppose this is a cell and we have placed a microelectrode. One is just outside the cell membrane and one is inside the cell membrane. And what we think that since it is a part of the body, so what should happen? There should be electroneutrality. That means no voltage should be recorded. But what actually happens is that if an electrode is kept across a cell membrane, one just outside, one just inside, there is a record of the voltage. This voltage is being recorded and this voltage is called as membrane potential. The potential which exists across the cell membrane is called as membrane potential. Remember, this is just only across the cell membrane. Otherwise, there is electroneutrality at other places. Now, what is the meaning of that? Suppose this is the cell. So, there will be potential across the cell membrane. Means what? Inside this, suppose this is the negative and outside it will be positive. But at the rest of the places, there will be an electroneutrality. That means positive charge, negative charge, positive charge, negative charge. Here also positive and the negative. So electroneutrality will be there at the other places. The potential will exist only across the cell membrane. And as you can see here, the inside is negative compared to that of the outside. Outside is positive compared to that of the inside. So this is actually the resting membrane potential. We call it as when the membrane when the cell is not stimulated, when it is in the resting stage, when it is not excited. So in that case, the potential whatever exists, normally it is negative inside and that is called as resting membrane potential. The value of the resting membrane potential will vary from cell to cell. But normally we can say that in a muscle or in a nerve, it is minus 70 millivolt. Now what is the meaning of minus 70 millivolt? Inside is negative compared to that of the outside, minus 70 millivolt. And how much is that value? 70 millivolt. Inside is negative. What actually an impulse will do? Impulse will cause a brief change in the membrane potential. Brief sequential change in the membrane potential. Now brief means what? For a very short time. Sequential change means suppose this is the resting membrane potential. Now what will happen? For some time, the value of the resting membrane potential can change. It can change from minus 70 to it can become minus 60 millivolt. So this we will call it as the local potential, right? And in that case, the local potential that will be generated, it can be of any value. It can go to minus 60 or even it can go to minus 80. So membrane will be hyperpolarized in that case. But in some cases, the membrane potential will follow a particular sequence. That it will become from minus 70, it can go to 0 value, and then for some time even it can go to plus 10 or plus 20. That means what? Inside will become positive, outside will become negative. And again, the process, after fraction of seconds, what will happen? The membrane will get polarized again. That means inside will become positive again, inside will become negative and outside will become positive. This process, which is when the membrane is polarized, means what? There is negativity inside and the positivity outside. When I say about the membrane will get towards zero level, That means what has happened to the polarity now? Even there is no potential across it. So in that case, we will call this as a depolarization. So when this will become either zero, or inside can become slightly positive and outside can become negative in response to that. So this will call as depolarization. But again, because of some ion fluxes, the movement of the current across the cell membrane, again the potential will be brought back to the resting membrane potential value, and this process will be called it as the repolarization. This whole process of depolarization followed by repolarization, this sequential change is called as action potential. So remember, action potential, once it is generated, it is of a full value. It will go to depolarization phase, it can go to plus 10 or plus 20, and then again it can come back to the normal. This is an all or none law. But as I have told you, impulse can even cause the local potentials. Local potential means what? The membrane potential can just become from minus 70 to minus 65 or minus 60. So, or it can even become minus 75 or it can go to minus 80. So, the local potentials can be graded one depending upon the strength of the impulse, strength of the stimulus. But the action potential is all or none law. Now, we will see it into the detail. Why we have this membrane potential. Recall that there is a difference in the concentration of the intracellular fluid and the extracellular fluid. As you can see in this table, there is an uneven distribution of the electrolytes inside and outside the cell membrane. How much is the concentration of the sodium outside? The concentration of sodium outside is 140 milliequivalent per liter, whereas that of inside is just 14 milliequivalent per liter. Whereas the concentration of potassium is much more inside, but whereas outside it is less. Concentration of chloride, which generally along goes with the sodium, is more outside, 125 milliequivalent, but inside is less, 9 milliequivalent. Proteins, that will be there more inside the cell compared to that of the outside. So what you see is that there is unequal distribution of the ions. Why there is unequal distribution of the ions? There is some excess of non-diffusible protein ions and other ions make the inside of the membrane more negative than outside. Now what is the meaning of this? As you can see in this picture, this is the cell. Now this cell has the few sodium, but more sodium will be outside. Potassium will be more inside, but potassium will be less. The chloride ion concentration is less inside and more outside. But what you see is these are the proteins which are synthesized by the cell. And now what is the property of these proteins? They are the negatively charged. Not only that, but they are one which are non-diffusible. They cannot easily cross the cell membrane. And because of the presence of this excess of non-diffusible protein ion, they are going to affect the concentration of these diffusible ions. Which are the major ions in the body? Sodium, potassium and chloride. So we will mainly speak in relation to them, because they are the one which are going to mainly determine the membrane potential. So what these proteins will try to do? Proteins are negatively charged. So if they are negatively charged, they will try to hold up some of the positive charges. And now when it comes to the positive charge, or when it comes to the cations, which are the cations which are present? Sodium and potassium. Now when it comes to the choice between sodium and potassium, they choose potassium. Why? This is the reason for that. As you can see here, at the rest, the membrane is impermeable to sodium ion. That means when the membrane is not stimulated by some impulse, the membrane remains almost, the channels for the sodium ions, they are almost closed. There is no permeability for the sodium ions. Whereas membrane is more permeable to potassium ions because of the potassium leaky channels, and membrane is partially permeable to chloride. So as you can see here, this is the permeability for the potassium, sodium and chloride. And what we can see here, the permeability for the potassium is 1, but look at the permeability for the sodium. It is just 0.04. So such is the low is the permeability for the sodium. So if the protein wants to hold the ions, which which ions they can attract? They can attract the potassium ions, because in the resting stage, membrane is more permeable to the potassium. Though the potassium will try to move out, but the proteins are the one which are holding them. This is called as Donnan's effect. So what is the Donnan's effect? Presence of undiffusible ion across a membrane will affect the concentration of the diffusible ion. So it will cause redistribution of the ions. That means what has happened now in this case now? The potassium will be more inside. But since the potassium ions will try to go outside also because of the concentration gradient, the equal number of positive and negative charges will not be there inside the cell. So there will be some negativity because of the more amount of the anions which are present, which are the non-diffusible one. So that's why there is a resting membrane potential is inside is negative. Next cause of the resting membrane potential, or why the membrane potential is there, is because of sodium potassium ATPase pump. Now what this sodium potassium ATPase pump will do? As you can see in this picture, the sodium potassium ATPase pump, what is the function of this? It will take 3 sodium ions and it will put it outside the cell in exchange of the 2 potassium ions which will go inside. Now what you see is that, and with the use of ATP. So what this sodium potassium ATPase pump has done? It has done 2 things. More and more sodium accumulation will occur outside the cell and less sodium will be there inside the cell because of the sodium potassium ATPase pump. Next, because of this pump, potassium concentration inside the cell will increase, and whereas that of the outside that will decrease. And when it comes to the charge now, in exchange of 3 positive ions, only 2 positive ions has been put inside. So ultimately what will happen? Negativity will generate inside, negative charge. So what the sodium potassium ATPase pump will do? Again, it is going to cause redistribution of the ions. And because of this redistribution of the ions, there will be negativity, potassium will be more inside, sodium will be more outside, and whatever the picture you see in the resting membrane stage is because of the sodium potassium ATPase pump, the Donnan's effect of the protein, and the membrane is more permeable to the potassium in the resting stage. So these are the 3 reasons mainly which are mainly responsible for the generation of the resting membrane potential. Uneven distribution of the ions. That's as we have seen that the potassium and the sodium and the chloride, they are unevenly distributed. So because of that now, and also there is a resting membrane potential which is there. So because of that, any ions such as sodium, potassium or chloride will face 2 forces. We will call it as a concentration gradient or chemical gradient force, and next is the electrical gradient force. Now what is the meaning of that? Suppose if the sodium ion concentration is more outside. So what will happen because of this now? Sodium ions, because of the concentration or chemical gradient, will try to go inside. So the concentration or chemical gradient force is directed inside for sodium ion. When it comes to the electrical gradient now, since this is, where is the negative charge? Inside. It will try to attract the positive charge. But so it will try to attract the sodium. So what will happen now because of this? The electrical gradient force will also be directed inside. So for sodium ion both, in the resting stage, the concentration gradient force and the electrical gradient force, that means the electrochemical forces, they are directed inside. But what is where you have to remember is that in the resting stage, the membrane is almost not permeable to sodium ion. But if at all the membrane is stimulated appropriately, then the permeability for the sodium ion can increase to 5,000 times. And in that case, if the sodium channels are open now, the permeability has increased, sodium will rapidly move from outside to inside if given a chance. But the problem here is that in the resting stage, the membrane is almost impermeable to the sodium ion. For the potassium ion now, can you analyze what will be the concentration and the electrical gradient force, direction of that? What will happen for the potassium? potassium ions are more inside, they are less outside. So because of that, what will happen? That they will try to move out. So the concentration gradient force or chemical gradient force is directed outside. But it is a positive ion. So and outside is positive. So positive will repel. So and there is inside is negative. So what will happen? The electrical gradient force will be directed inside. So this is the situation when the potassium will. Normally, what will cause the net amount of any ion across the membrane? It will all depend upon the equation of the how much is the chemical gradient force, how much is the electrical gradient force, and how much is the permeability of the membrane to that particular ion in that situation. Suppose if I change the picture now, what I told you in action potential, what will happen? The inside will become 0 volt, or it can become slightly positive. So if inside has become positive, what will happen to this arrow now? This arrow will change the direction, and even the electrical gradient will be directed outside, and now the potassium ions can move outside rapidly. When it comes to the chloride ion, for the chloride ion, what is the picture? Chloride ions will be more outside, they are less inside. So the concentration gradient is directed inside, but chloride ion is negative. So what will happen because of that? The negative will repel. So the electrical gradient force will direct it outside. So this you have to remember, as you can see in this picture. So for the sodium ion, the concentration gradient force as well as the electrical gradient force, they are directed inside. For the potassium ion, the concentration gradient force is directed outside and the electrical gradient force is directed inside. For the chloride ion, the concentration gradient force is directed inside and the electrical gradient force is directed outside. Now, what will happen if we just isolate the cell membrane, and with the patch clamp technique we can do that, and then we increase the permeability for only one ion only. In that case, what will happen? Suppose if I increase the permeability only for the sodium ion. So what will happen in that case? As I have told you, the concentration gradient as well as the electrical gradient force for the sodium ions are directed inside. So now what will happen? Rapidly sodium from outside will start going inside. This is called as influx, or the inward current of the sodium will take place. Now what will happen because of that? The sodium ions will go inside. The concentration gradient and the electrical gradient force are directed inside. Now from minus 70 millivolt, the membrane potential, since a positive ion is going inside, so from minus 70 millivolt, the potential will go to minus 60 millivolt, minus 50, then minus 40, and then it will reach to minus 10 and 0 millivolt. There is further influx of sodium ion. Now what will happen? The membrane potential will become plus 10. In that case, what will happen to the electrical gradient force now? In this case, since inside is becoming positive now, it will repel the further influx of the potassium or positive ion. So the electrical gradient force will direct it outside now, and this arrow will become like this. More and more sodium ions are coming inside, plus 15, plus 20 millivolt. At that time, what will happen? This arrow will become strong, and a time will come when the concentration gradient force and the electrical gradient force, they will balance each other. And at that time, there will be no net movement of the ion across the cell membrane. The movement will stop because the concentration gradient force, electrical gradient force, they are opposite to each other and they are equal in magnitude. So this value of the membrane potential, where there is a concentration gradient and electrical gradient force for the particular ion, will become equal and there is no net moment of that ion, is called as equilibrium potential value for that ion. We can calculate this equilibrium potential value with the help of the NERNST equation. What you see in this NERNST equation, this equilibrium potential value EM is equal to minus 2.3. R is the gas constant, T is the absolute temperature, F is the Faraday, and Z is the valency of that particular ion which we are counting. So minus 23 RT upon Fz log to the base 10 of concentration of that particular ion outside to the concentration of particular ion inside. So minus 2.3 RT upon Fz in standard conditions, it comes out to be 61 millivolt at 37 degrees Celsius. So if we substitute, now we know the concentration of the ions outside and concentration of the ions inside. So we can calculate the equilibrium potential for the major ions such as sodium, potassium and chloride. So as you can see in this slide now, what is the equilibrium potential value for the sodium ion? It is plus 61 log of 140 upon 14. Concentration outside is 140 and concentration inside is 14 milliequivalent. So what you will what value you will get? The equilibrium potential value for the sodium ion is plus 61 millivolt. Now this concept should be clear. When I say about the equilibrium potential value for the sodium ion is plus 61 millivolt, what is the meaning of that? That at plus 61 millivolt, when the membrane potential value is plus 61 millivolt, that means inside it is positive, outside is negative, and how much inside is positive? Plus 61 millivolt. At that time at that voltage of the membrane potential, there is no net movement of sodium ion, because the concentration gradient and the electrical gradient force will balance each other. The concentration gradient force will be directed inside, the electrical gradient force will be directed outside, and they will balance each other and cancel each other. So therefore there is no net movement of the ion. So in other words, if I want to say that if I give permission to sodium ion to change the membrane potential, if I increase the permeability of the sodium ions only, there will be influx of the sodium ion and the membrane potential will stabilize at plus 61 millivolt. Next, what is the equilibrium potential value for the potassium ion? The equilibrium potential value for the potassium ion is minus 94 millivolt. Now what is the meaning of this? Try to analyze this. Minus 94 millivolt. That means what will happen now? If and if only the potassium permeability is increased maximally, then potassium minus the equilibrium potential value is minus, that is 94. That means what will happen now? The potassium ion, a positive ion form inside will go outside. So there will be efflux of the potassium. So the potassium efflux will continue because the concentration gradient force is directed outside. But when it will stop? When the membrane potential will become minus 94 millivolt, because at that time the electrical gradient force will be directed inside, concentration gradient force will be directed outside, and they will balance each other and cancel each other. So if the potassium wants to change the membrane potential, it will take it to minus 94 millivolt. When about the chloride, the equilibrium potential value for the chloride is minus 70 millivolt. That means it is if at all the chloride gets a chance, the membrane will get more stabilized at the minus 70 millivolt. What are the assumptions of the NERNST equation? When we are carrying about the NERNST equation and the equilibrium potential, what we assume? Membrane is selectively and totally permeable to only single ion. Each ion is electrochemical equilibrium. Each ion will what it will achieve? A electrochemical equilibrium across the membrane. And diffusing ion is isolated from the other ions. But actually this is not the situation in the body. What is the situation in the body? In the resting stage, the membrane is permeable to some ion, membrane is not permeable to some ion, membrane is more permeable to potassium ion. So, as I have told you, if I give a chance to sodium ion increases permeability, it will try to take the membrane potential to its equilibrium potential level. That is 61 millivolt plus 61 millivolt. But in the actual resting stage, how much is the contribution of the sodium? The contribution of the sodium towards the membrane potential is equal to the equilibrium potential value multiplied by its permeability. So each ion will contribute according to that. Who has got more permeability? Potassium ions. So the contribution of the potassium ion will be much more compared to that of the sodium ion when it comes to the generation of the resting membrane potential. But if I change the permeability for the sodium ion now, what will happen? The contribution of the sodium ion will be more and the membrane potential will try to go towards plus 61 millivolt. So this is called as diffusion potential. That means the equilibrium potential multiplied by the permeability. Permeability will change from time to time. In the resting stage, it is more permeable to the potassium. But if appropriate stimulus is given, the permeability for the sodium will increase. So permeability will change. So the contribution of each ion at a time is given by the diffusion potential, which is equal to equilibrium potential value multiplied by the permeability, as you can see in this equation. So, which are the three major ions in the body? Sodium, potassium and chloride. And these are the three which are going to contribute to the membrane potential. And how they will contribute? Depending upon their permeability. Right? So, summating all that together now, a value of the membrane potential can be calculated by the Goldman constant field equation. Now, what is this Goldman constant field equation? V, that is the value of the membrane potential, is equal to RT upon ZF log of, then this is called as the P is the permeability for the potassium ion multiplied by the concentration outside, then permeability for the potassium ion multiplied by the concentration inside for the potassium ion. So in this way we calculate it for the potassium, sodium and chloride ion. And ultimately with all these contributions together put together, the summated activity of that is ultimately is going to give the membrane potential at that value. Right? So this is called as Goldman's constant field equation. As I have told you, the permeability in the resting stage is 1 for potassium, 0.04 for sodium and 0.0 that is 0.45 for chloride. So if I put these values, I get the resting membrane potential approximately minus 70 millivolt. Resting membrane potential is present in all the excitable cells. That means when they are excited, there will be change in the resting membrane potential. Membrane potential only cross the cell membrane, electronegativity at the other places. This important point you have to remember. It is only across the cell membrane. Whenever the cell gets excited, the permeability for the sodium ions may increase many times, and ultimately the membrane potential will be drawn towards the equilibrium potential value for the sodium ions, right? So to revise, the Donnan's effect, and the membrane is more permeable to potassium ion, and the sodium potassium ATPase pump will cause uneven distribution of the ions. This uneven distribution of the ions will generate diffusion potential, and the summation of diffusion potentials will give the value for the membrane potential, which can be calculated by the Goldman constant field equation. And the permeability of the membrane can change from different times and different stages. So with this we come to the end of this lecture. Thank you.